Good evening, everyone, and welcome to the first of two panel presentations titled Long COVID, Not Crazy or Lazy, Exploring Impacts on the Patient and Community. This is a Clarkson College Leadership Series event presented in collaboration with the UNMC College of Public Health. We are so happy that you can join us. I would like to introduce myself. My name is Sarah Flanagan. I'm the Director of Community Health and Interprofessional Education here at Clarkson College. I will be your moderator for this evening's panel presentation. I would like to share with you, just briefly, a little bit about the genesis of this idea. As we all experienced firsthand the COVID-19 pandemic evolving and unrolling before our eyes, it became apparent quite quickly that there was a lot of things that we were learning and a lot of new unknowns. As more people began to experience the lingering effects of this virus, we also realized that we were entering into new uncharted territory. There hasn't been a lot of information on long COVID until just recently, and what is there has tended to either be really clinical in nature and therefore hard for many people in the general public to understand, or we see more of those individual human interest type stories covered by local media. Sharon Eden, who teaches in our community health and general education programs here at the college, approached me to see if there was something that we at Clarkson College could do to help address this growing need. We wanted to be part of the solution, not that we could conduct all the research studies or produce new treatments, but rather, how could we be a vehicle for sharing information? How could we bring people together? Excuse me, just one second. How could we bring people together so they didn't feel so alone or misunderstood in their experience? We wanted to bring a human touch to this evolving situation and to help increase awareness and empathy related to those living with long COVID. In response, we brought together a wonderful team of dedicated professionals to help create these two panel presentations. We already had a Clarkson College Leadership Series as a platform through which we could reach out to people across the state and region. We also have an amazing team of faculty in our community health department who have already been integrating material on COVID and long COVID into their courses with students, and so we involved them as well. As mentioned, we really wanted to create an experience that helped bring people together, to help them feel informed, connected, and empowered so that they can help themselves, their families, and their surrounding community. And as you all know, in light of social distancing measures, we determined that Zoom would be the most appropriate way to deliver our message. And so here we are. Thank you all for joining us and for being part of this ongoing conversation and circle of support. And so without further ado, I would like to introduce you to each of our panelists. I'll be mentioning them in the order in which they'll be presenting this evening. We'll begin with Sharon Eden, who I mentioned just a moment ago. Sharon is an associate professor of microbiology, epidemiology, and environmental risk factors and disease here at Clarkson College. She had the great idea to create this presentation. Thank you, Sharon. She will start all of us off with an overview on what long COVID is and what we need to understand about it. Next, we'll have Sarah Swanson. Sarah has graciously offered to cover the information for Karen Vincent, who unfortunately woke up very sick this morning and is unable to join us. Karen prepared the slides and the information, and Sarah will be the one delivering the message. They make an awesome team. Sarah's an assistant professor at the UNMC Monroe Meyer Institute, just across the street from where we are right here. She also has a master's degree in public health, and she's an adjunct faculty member with our community health program here at Clarkson College. Next, we are blessed to have Jamie Robertson. Jamie is a student in our BSN program, and she'll be sharing her experiences as someone who's living with long COVID. We'll be really appreciative to Jamie tonight for sharing her personal journey and helping to bring a firsthand account to this often misunderstood condition. Finally, we'll round things out with Maureen O'Donnell, counselor and owner of Arbor Family Counseling. Maureen will talk about the impacts of long COVID on one's mental and emotional health, as well as some tools and coping strategies to help patients, families, and providers. I want to thank everyone for working so hard to put this together. and for all of you in our audience for taking the time to be here with us this evening. One quick reminder before we get started, for all of our audience members, we will be muting everyone and having the videos turned off just to avoid any distractions during the presentation. But we do encourage you to type questions into the chat box so that when we get to our Q&A portion, we'll have those questions ready for our panelists to answer. All right, first one up is Sharon Eden. The floor is yours.
Okay, I hope everyone can hear and see me all right. I think I have control of the PowerPoints now. Well, hello everyone and welcome. And thank you, Sarah. And as Sarah said, my name is Sharon Eden, and I am an associate professor here at Clarkson College. I teach microbiology, epidemiology, and environmental risk factors and disease. Basically, that means that I teach Clarkson College students about diseases, what causes them, how you know you have them, is there anything you can do to prevent getting them, and maybe some management of the disease if it's a little too late. Today, well, my job right now is to hopefully shed some light on what is COVID, long COVID. And there's a lot of confusing terms. Whoopsie, I thought there, whoop, then I went too fast. There's a delay. All right. There's a lot of terms being thrown around, and I'm not surprised if you're a little confused by some of these. In the left-hand corner, you see SARS, coronavirus, and COVID/COVID-19. SARS and coronavirus, that's referring to the virus or bug that has been causing this pandemic. The disease is known as COVID or COVID-19 if you want to include the year that this COVID was identified, 2019. On the right-hand side, this is what we call the disease if you don't recover. There are people who they recover from the virus and COVID-19, but they continue to have symptoms. So we sometimes refer to them as long haulers, or the condition is long haulers, or long COVID. There's post COVID. And the scientific medical community now came up with an impossibly long name that they abbreviated as PASC, which stands for Post-Acute Sequelae of SARS Coronavirus version 2. And how about we just call it long COVID, right? Yeah. This is the virus or the bug that started it all. You may have seen its picture in the news, and I put a little identification tag on it. This is SARS coronavirus 2. SARS stands for Severe Acute Respiratory Syndrome. There's a group, a family of viruses called coronaviruses, and there's a few of those viruses that can attack the respiratory tract, and sadly, even more areas of the body. You may be familiar with the SARS version 1.0 that we experienced in the year 2003. That virus wasn't quite as aggressive as this one, and it never really occurred in the United States. It turns out our Canadian neighbors up above, well, they had a pretty good public health strategy, and they stopped it from getting to the United States. This one, unfortunately, is much more complex. How do most people get this virus and COVID-19 disease? You probably know this. You breathe it in from the air. Once the virus gets in, it replicates in your cells, and you are infected with the virus, and you may or may not experience symptoms. The original disease, we call this acute COVID-19. Acute. Acute is a word we use in medical terminology. It means it's a disease that doesn't linger. It comes on pretty rapidly and then it either goes away or sadly you don't survive. Once the virus enters, you may have any number of symptoms. It could be deadly or serious symptoms, severe to mild symptoms, or you may have no idea that you had the virus at all. Can I get long COVID even if I never felt sick? If you had the virus, you're COVID positive, you can get long COVID even if you never knew you had it, whether you had symptoms or not, right? And I apologize for this very busy slide. In this slide, what I wanted to do was compare acute or fast COVID with the long COVID, which is a chronic form, it lingers. So in the left-hand column, the acute or fast COVID begins by the virus getting in. When your immune system detects the virus and its presence, well, it sends out a lot of immune warriors and they fight and they have chemical weapons and that causes inflammation and that results in symptoms. During this phase, well, okay, there's viruses. They're replicating in your cells. It's probably contagious. You may not even know it. You may not have symptoms, or you might have that classic COVID lack of taste and smell. You might have anything in the flu-like symptoms category. Now, I know what you're thinking, but this isn't the flu, right? Yeah, you're absolutely right. We call the viruses that get into the lungs and cause the same symptoms. We call those symptoms flu-like symptoms, whether we're talking about influenza or other viruses that unfortunately get in there. This can cause achiness, you can become feverish, you can have a shortness of breath, and that fatigue. There are many more symptoms that you can get with COVID, and there's just not enough room here. A lot of them will carry over into long COVID, so we might cover some of them there. Now, the COVID symptoms should go away within 4 weeks. Why? Because within that 4-week period, your immune system warriors should have fought it off. And okay, the virus is cleared and everyone's just really quiet, no inflammation. However, yes, some people go on and have a long, lingering or chronic COVID. The symptoms don't go away. This is probably not because of the virus. We do think it's because your immune system is still causing inflammation or because you have inflammation damage. Because it's not viral, that's what the evidence says, you're probably not contagious. Now, the symptoms in long COVID don't go away even after 4, 8, or 12 weeks or more. There are many symptoms associated with long COVID, and my apologies if I miss one that you are struggling with and that you feel is very important. There was just enough space to put the most common symptoms here. So poor sleep, fatigue, headache might be very severe, difficulty breathing, shortness of breath, and maybe chest pains. Here's one, odd and or a fast heart rhythm. Your heart rate might go up, or it might be irregular. Sometimes this occurs and is triggered because you rolled over in bed or you sat up in bed, and it's a positional problem. In addition to that, your blood pressure might shoot up or crash and you become dizzy. Long COVID can also cause kidney injuries. When your kidney is injured, you may experience frequent urination, fluid retention, meaning hands and feet and legs and calves and all of that become swollen. And when your kidney doesn't work well, you can have heart rhythm problems and fatigue just because of the kidneys. I know, right? Rashes. You can get rashes anywhere on your body, and sometimes they come and sometimes they go. Hair loss. This was brought to the attention, I'm reasonably sure, to the doctors, because they were seeing, well, we think it was the nurses that started kind of clarifying this one, but their patients would sit up and a lot of their patients' hair would remain on the pillow. So the nurses were observing this quite a lot. There's the COVID toes, which really doesn't have to be just the toes. It could be your feet or your legs. Yeah. COVID toes can be something like, I've got numbness, I've got tingling, I've got pins and needles, or real pain. We think this is probably due to blood clotting problems because, oh yeah, long COVID can cause blood clotting problems. There's the COVID brain fog, which I'm going to stop and say this is a type of dementia. It's not, golly, I forgot where I left my car keys. No, this is, I forgot what car I drive. There's a range here as well. It could be a difficult, you have trouble finding the right word or words. There we go. Or it could be very severe. There was a New York reporter who said that, well, he was going through long COVID. He said he can't remember that he went to Paris on vacation the previous year. Can you imagine? But everybody told him he went to Paris on vacation. There's psychiatric problems like depression, anxiety, and mood disorders. I know what you're thinking, but we're going through a pandemic. Who isn't just a little depressed or anxious? No. This is beyond that. The studies show that they're taking into account that we're going through a horrible, terrible pandemic, and it's very stressful and just not good for anyone. This is occurring in people in their 30s, 40s, and 50s who have never been diagnosed with any psychiatric problems before. And Maureen might be able to address more about this too coming up. So why me? Why does this happen to some people? There's still a lot that we need to learn, but at this point, here's what we know. It's probably not the virus anymore. It's not that. We think long COVID arises in two ways. Number one, your immune system, your warriors become confused. The virus and traces of the virus are gone, but you're still fighting it. So you've got that inflammation, and again, inflammation equals symptoms. Number two, this is in some other people. When you had the original acute COVID infection, damage may have occurred. And so during the battles, you have a military action, inflammation, damage, and that damage is still there. Even though the virus is gone, you're still experiencing this. So those are the two things we think are going on. Why does this happen to some people who is at risk? Most studies agree there are three categories. Females, yay, being an asthma sufferer, or having the acute COVID, the original COVID, with 5 or more symptoms. Interestingly, we're still not sure if other pre-existing health conditions put you at risk. They will put you at risk of getting the virus, but getting long COVID, we're not really sure about that yet. I also want to point out that when you hear someone say low risk, that doesn't mean no risk. Who has the problem? It's not just you. There are many struggling and fighting with this, and there will be many more, sadly. Long COVID will probably have a very large public health impact. There was a study that was done at the end of last year. The scientists, they were a group of scientists based in the United Kingdom, Great Britain, But they were also looking at people who had COVID in the United States and Sweden. They looked around. They had about 4 million participants. What they found is 1 in 7 people who got COVID ended up with symptoms past 4 weeks. 1 in 20 people infected with the virus, they said they're likely to suffer from long COVID for 8 weeks or more. 1 in 50 will have symptoms for 12 weeks or more. How does that translate to the United States and our public health system? Well, I looked this morning and the CDC is reporting that we have 32.6 million confirmed COVID cases here in the United States. If 1 in 7 with COVID will have long COVID of some point, at some extreme, it could be past 4 weeks, but the estimation then would be 3.2 million US people are experiencing or have experienced low COVID. Keeping in mind, that's if everything just stops today and no one else gets COVID. A lot of experts say that this problem is really 10 times worse than that. If you're thinking that I'm just trying to make things just very emotional, it makes sense because a lot of people don't get COVID tests. So if you don't get tested, you won't count in that 32.6 million. All right. I mean, some people, they just don't get, sometimes they just don't get, tested. All right. Sorry. Didn't mean to bump that. Okay. Now we're stuck. There we are. What can I do? Yes. Well, here's where to begin. Start with your medical practitioner. Because really no one size fits all path is going to work for everyone. Everyone is different. Many will need more than one healthcare professional, but I think most people should start with their primary medical practitioner. From there, talk with nurses. Maybe they need to be on your team. Physical therapists, but that's when you're ready to get your strength back. One of the things we're finding is some people try to do too much and they overexert. That makes symptoms worse. So keep talking to your primary medical practitioner. Mental health counselors, you might need one on your team. Maureen will talk about this. A neurologist. Why would I need a neurologist? Why do I need a doctor who studies the nervous system? Well, if you're one of those people who are struggling with the brain fog, or when you get the strange heart rhythms when you move, or the blood pressure goes up or down, or you have the pain and tingling, a neurologist might be what you need or who you need there. Support groups. There are support groups being formed. Find the one that works for you. If you don't know where to begin, we have a great resource packet for you. So look through there, find one that works. It's better. I think you will agree that people who aren't going through long COVID are not going to understand long COVID. Talk to someone who's going through it and you can share your experiences. Why doesn't someone know what to do for me? Why is this so complex? Well, because it's complex. Everyone is different. There are many long COVID problems, and it can be complicated, as I've been pointing out. Sufferers of long COVID, their families, and healthcare partners will need a lot of resources and information to make good choices about long COVID management. And we don't have all the answers yet, but we're getting them. We're learning more and more every day. Keep in mind, I understand if you're feeling very impatient, I don't blame you, but keep in mind, at least for the United States, COVID-19 has only been on the public health medical science radar for about 17 months. So believe it or not, a lot has already been learned, but we need more. The last point I have underlined, because keep looking if you can't find good resources in your area. I'm sure people from smaller communities, rural communities are zooming in right now. Hi there. Keep looking, and there are online resources for you. No matter what, take care and hang in there. Keep looking, keep asking questions. Time for a review. Long COVID. What is long COVID? Again, long COVID is having COVID symptoms beyond 4 weeks. However, this can continue past 12 weeks. Do you have to have experienced early COVID symptoms to get long COVID? No. Do you have to have another health condition to get long COVID? No. Do you have to be older to get long COVID? Nope. Are long COVID sufferers rare? No, and the numbers are increasing. Does everyone with long COVID have the same problems and need the same care? No. Am I lazy or crazy if I have long COVID? No, no. And be patient with yourself and be kind to yourself. If you are someone who lives with, works with, or is taking care of someone who is struggling with long COVID, please be patient. This might be quite the long road for them, and it probably isn't going to be easy. I hope this will be a good step for you. I want to thank you very much for attending tonight. And if you have any questions, I will, of course, be available in the Q&A session at the very end of this webinar. As always, here are some references that I cited directly. But once again, take a look at our resource packet. I have other references there, but there's also some really great things to explore to get some help. And once again, thank you very much.
Thank you so much for that insightful overview, Sharon. It's really helpful, I think, for all of us, regardless of our occupation or our age or where we're at in life, to really get a better understanding of what's happening when these COVID symptoms extend beyond just those first few weeks. And it's good for all of us to get accurate information and also to know that we're not alone. So thank you, Sharon. Our next speaker is going to be Sarah Swanson, and I'm just going to try and make sure I get control here of the screen. Okay, so Sarah is going to, like I said, help cover some information on the public health perspective. And so we appreciate you being here, Sarah. I will control the slides, and just let me know when you'd like me to progress to the next one.
That's great. Sarah, I'm not able to share my video.
Okay.
So
we'll see. Kay, can you help with that?
Yeah, so Sharon, I just want to thank you very much for your presentation. As somebody that was personally impacted by COVID, and I have family and colleagues that are affected, many of whom are being impacted by this long COVID, I felt like your presentation was really informative and very timely. So as Sarah Flanagan shared at the very beginning, tonight I'm filling in for Karen Vincent, who has several roles. She too is an adjunct faculty at Clarkson, but her full-time job is in the Division of Public Health at the Nebraska Department of Health and Human Services. There, she's a public health strategic advisor, but she's also been serving as the interim deputy director. Sorry, I'm getting okay. So you should be able to see my video now. She's been serving as the interim deputy director of health promotion for the last 14 months. So this presentation tonight is as a result of Karen's experience and her perspective, and is coming from the lens of the state public health departments. Local health departments or other members of the public health community would likely have a very different experience through the pandemic. Next slide. Oh, so actually, Nebraska has what is called a decentralized public health system. We have the state health department, the Division of Public Health at the Department of Health and Human Services, and also 19 local health departments that cover every county in Nebraska. That system of local health departments was created by the Healthcare Funding Act of 2001, though some counties like Douglas County have had their health departments for much longer than that. So this is a map of Nebraska's local health departments. And as I said, every county is covered by a public health department, though as you can see, some cover much larger areas than others. For example, Panhandle Public Health Department in the western part of the state serves a much larger geographic region than our other public health departments in eastern Nebraska. Next slide. Overall, public health in Nebraska aims to convene partners to improve and protect the health of the community. Public health organizations work hard to know the people they serve, and they work to bring the right people to the table to ensure that the health, safety, and well-being of all the people they serve. The Healthcare Funding Act of 2001 that created our current system of local health departments across the state also referenced the three core functions of public health. That is assessment, policy development, and assurance. Assessment means that we collect and analyze information about the health problems experienced in Nebraska communities. Policy development means that we work with partners to apply data, we educate the public, and then we develop programs and policies, all so that we address and prevent illness, disease, and disability. And then finally, assurance means that we promote effective coordination and use community resources to protect the health and well-being of Nebraskans. All the time, especially during this pandemic, public health has been working hard to continue to meet these three core functions: collecting, analyzing, and reporting case information, and now vaccine information and distribution. We have been using this data to determine policies to prevent the further spread of COVID, from using it to determine restrictions in the state's directed health measures, to determining when case counts are low enough to loosen some of these restrictions. And finally, much of public health has worked extensively to educate the public, identify and use the resources in the community to educate people about the pandemic and how they can protect themselves, their family members, and stay safe. Next slide. The work of public health departments can really be summarized by the 10 essential public health services you can see in this graph. As you can see, it has assessment, policy development, and assurance all around the outside of the wheel, with the core programs and activities of health departments in the circle. These provide a guiding framework for the responsibilities of our public health agencies. Next slide. Throughout the pandemic, public health has faced many challenges. Of course, the types of challenges faced varied very differently across the public health departments, but some of the major ones that we saw at the state were limited resources, including limited staff, geographical challenges, and the lack of services. These each will be discussed in greater detail. But many of the public health agencies are very good at doing work with limited resources, but the pandemic posed a new challenge. There was suddenly many people who were ill and needed assistance, but there was not enough support to accommodate the needs. For example, there wasn't enough personal protective equipment for healthcare workers. There were limited testing supplies, and we all saw the shortage of normal household items like Clorox wipes and toilet paper. Many of our health departments have small staffs or only one person doing this type of work. This created challenges for health departments as the workload grew considerably to investigate cases and do contact tracing, among other things. At the state, they had to shift about 250 people to work on contact tracing in April of last year and for several months, just so that they could stay on top of the increasing cases in Nebraska. In more rural areas of the state, particularly in western Nebraska, we saw a lot of geographical challenges. There are large geographic areas with very few people and services. This means that people had to travel quite a ways to access testing or even access healthcare or vaccine clinics. And finally, there was a lack of services. This was a challenge everywhere, but particularly in areas that were rural in our state. There was and is a shortage of healthcare providers. So people had a very hard time accessing testing or medical care if they were ill. There are also limited services to help provide support to people required to quarantine or isolate or be isolated. Everything from food delivery to transportation, even spaces they needed to quarantine or isolate. Next slide. Again, this is a map of Nebraska and the public health departments. As you look across the state, we have many rural areas. There are counties that have more cattle than people. The public health departments in these areas face very different challenges than those in more populated areas like Lincoln, for example. As I said before, there are very large areas of our state that have very few people, and approximately 2/3 of the state's population live in the eastern third of the state. Next slide. The lack of public transportation and even ride shares like Uber and Lyft outside of urban areas has also provided challenges for people trying to access vaccination sites and other supportive resources. And again, limited access to healthcare and other services was a challenge for many communities. I've already talked about this, but I'm going to say it again. These challenges had a major impact on our COVID response in communities across the states. Next slide. Access to testing, vaccination, and care were all impacted by limited access to transportation or healthcare. And limited resources reduce someone's ability to access all the necessary services, including the need for healthcare and other wraparound services to support the whole person through this pandemic. Next slide. The State Department did a number of things to support COVID response. For the past year or more, they've issued regular directed health measures that have provided restrictions and guidance designed to limit the spread of disease, prevent further infection, protect the capacity of our healthcare system, and keep Nebraskans safe and healthy. They created a data dashboard, which was reporting on the number of key data points throughout the pandemic. They've written and provided both guidance documents and recommendations and education for healthcare providers, public health, and the public to help them understand how to stay safe and healthy. These include guides for long-term care facilities, restaurants, and guides for extracurricular events, both indoor and outdoor events, services, and guidance for businesses, among others. Next slide. In order to make the information as accessible as possible, they translated many of our documents into multiple languages to reach as many people as possible. They also provided a number of programs designed to meet the needs of the community. For example, they had an accommodations program created to provide housing for healthcare workers, first responders, and other critical workers who were at high risk of exposure in their workplace. They were able to house them in hotels for a period of time to protect their families and other high-risk people living in their households. They also issued community cares grants using the first round of COVID relief funding from the federal government. These were grants to help charitable organizations and care providers in our states and help them respond to and recover from the pandemic and help them keep their businesses open. As I mentioned earlier, they also did contract tracing to help provide additional support to our local health departments, starting by shifting about 250 DHHS employees from their regular jobs to work in contact tracing. The goal of this was to contact all people who tested positive for COVID, identify the people they had close contact with, and then have them quarantined to avoid spreading the disease to anyone else. Finally, they've also had large-scale testing and vaccination campaigns. Test Nebraska is a statewide testing program with the goal of making testing available in all parts of the state. And our vaccine campaign is ongoing, providing support to local health departments in their vaccine efforts to vaccinate as many Nebraskans as possible. Next slide. The best advice Karen suggests as we move forward is to find and lean on a support system. COVID has presented an extraordinarily difficult year, and we can't come out of it without the support of those we care about. From a public health perspective, we need community. Mental health and well-being is part of someone's overall health, and we have to have community to be healthy. So reach out if you need it. Across Nebraska, there are a wealth of services and supports designed to help people in all situations and settings. Health departments are a great resource, and even if they don't provide the services you need, they can often connect you to what you are looking for. And finally, we all just need to be a little bit patient. Again, it's been a difficult year. And as we And I think we can see the light at the end of the tunnel, but we must hang on and be a little patient a little bit longer before we can expect things to go back to normal and get back to our pre-pandemic lives. Be patient with yourselves and with one another. We really are just doing the best we can. Thank you.
Thank you, Sarah. We really appreciate you helping us understand that public health perspective, how the system works, the different opportunities and the challenges that have been faced by people all across our state. And it's always nice to hear about the whole team of people in the background who are really working as hard as they can, day and night, to make things as good as we possibly can in this really challenging situation. So thank you for taking the time to share that with us tonight. We're happy to have you on our panel. Next, we are going to hear from Jamie Robertson. As mentioned, Jamie is a student here at Clarkson College, and she'll share her experience battling long COVID. So go ahead, Jamie.
Good evening. My name is Jamie Robertson, and I'm just making sure I have the screen. As Sarah mentioned, I'm currently a nursing student at Clarkson. I'll be starting my 5th semester in about a week. If all goes as planned, I should graduate next August. Yay. As a side note, Miss Eden was my microbiology instructor last summer, and we spent quite a bit of time after class discussing COVID and the progression of information as it became available. She's a fascinating person. I'm a Des Moines native. I met and married my husband in 2002, and we moved out east to the DC metro where both of our kids were born. And then we moved to Husker Nation in 2006. My husband and I just celebrated our 19th anniversary in March. My son Kent is 17 and just wrapping up his junior year. My daughter Ariel is 15 and she's a sophomore. I've been a homeschooling mom since the kids were in preschool, long before the pandemic made homeschooling cool. I worked from home all those years while educating my kids. As you can see in the picture, I've done a stellar job. Don't they look very well adjusted? Through a number of circumstances in 2019, it brought about several life changes to our family, especially me. We moved from our home that we had built in West Omaha in 2006 into a 115-year-old Foursquare and Field Club. I started the road to nursing school at Metro before transferring to Clarkson a year later. And then I went to work at the Neuro ICU at Nebraska Med, all within a 2-month period. I'm a super healthy person. In fact, my Fitbit tells me that I'm 8 to 10 years younger than my actual age. I like my Fitbit. I'm really a go-getter. I'm positive, upbeat, and I like to think that anything is possible if you put your mind to it, add enough elbow grease in YouTube videos, and pray hard. I'm often referred to as a machine by my close friends. If you know me well, you know I don't let grass grow under my feet for very long. So when I describe my personal COVID experience, please understand that I'm incredibly thankful that my family story was far less life-altering and painful than so many. However, long COVID has changed my normal over the past several months. And before I had my own experience, I had little awareness of the lasting effects of COVID or what it really even meant, even though I had cared for critical patients in the ICU for nearly a year before I experienced my own story. And here's my story. So I worked with COVID patients on the COVID units at Nebraska Med for the first couple of months of the pandemic. Then I went back to the neuro ICU in June last summer, but I continued to bounce over to COVID from time to time, just working as an extra. On Wednesday, December 9th of 2020, I finished up my last final for the fall semester. I had a bucket list of projects to complete on my old home and all kinds of Christmas to tend to. And I was looking to my long 4-week school break. And little did I know that I would go home that day for my last final to hear my son and a deep cough rumbling from his room. I confronted him, and in typical teenage boy fashion, he passed it off as, "It's just the weather, Mom." But I'm a mom, and I know things. Alarm bells went off in my brain saying this is not okay, but I just let it go. My husband and son ran off that weekend to a basketball tournament in Kansas City. After they arrived, we received notice from his coach that he would not be attending the tournament due to illness and out of abundance of caution. I worked that Friday and Saturday, and by the last 2 hours of my shift on Saturday, December 12th, I knew something wasn't right. By the time I got home that night about 7:30, my worsening sore throat was now accompanied with body aches, chills, and that overall yuck feeling. My daughter met me in the living room with the same complaints. My son and my husband came home from the weekend tournament, and my husband was now coughing and sneezing endlessly. I said, "You're sick, aren't you?" And like father, like son, "Oh no, it's just the weather." But by the time he came to bed a couple hours later, he decided he was definitely getting sick. It was about that time that we received a notice from his coach that he had tested positive. So when we woke up on Sunday, December 13th, feeling even worse than the night before, we knew we were in trouble. On Monday, we all went to get tested, and sure enough, after 10 months escaping the pandemic, COVID had finally caught up with our family. We all tested positive. My daughter had a lot of similar symptoms that I did, but she also slept. I mean, she's 15, so 15-year-olds sleep a lot, but she slept literally more than she was awake. She would sleep, get up, stay awake for an hour, fall asleep for 3 or 4 hours, get up for an hour, and fall asleep for 3 or 4 hours. And this continued for her for months, about 2 months. For me, I didn't sleep as much, but I couldn't even peel myself off of the sofa. I had a debilitating migraine for the first couple of days. And then beyond that, I felt like I did back in 2018 when I experienced influenza A and B at the same time, which also put me out of commission for about 2 weeks. I think one of the most interesting symptoms that I hadn't heard very often was how badly my back hurt. I literally couldn't even sleep without 800 milligrams of ibuprofen every night for about 2 weeks. But I could still taste and smell. I didn't eat anything more than like crackers and tapioca pudding, but I did the sniff test regularly just to be sure. And on Tuesday, I came down the stairs and my usual greeting of coffee smell didn't hit me that morning. And that was that. My taste and smell were gone. So we were supposed to, this was Tuesday the 15th, I think. We were supposed to head to Des Moines on Tuesday and celebrate Christmas with my family. My sister, who was back in the States from Germany with her family, were going to meet us in Des Moines, and we were going to celebrate Christmas together. And I hadn't seen them for 3 years. And it takes an act of Congress pretty much to get us all together at the same time. And even after having it planned out for months, COVID managed to break up the party. Throughout the next couple of weeks, very little changed in my symptoms. I pretty much woke up every morning, walked down the stairs, and landed on the sofa where I just stayed all day long, very happily. In fact, I dreaded having to get up to go to the bathroom. And by the time I actually got to the bathroom, I had to rest. I pretty much ate nothing, partly because everything tasted like nothing, but I also had zero appetite and zero energy to even make the effort. By day 13, which was Christmas Eve, I finally had a little bit of energy and I felt like my symptoms were maybe becoming a little more mild. By Christmas Day, we were outside of our quarantine window and it was the first time I even had a desire to get off of the sofa and do something. So Doug and I, my husband, decided to have a Christmas date, and we went to the only grocery store open on Christmas Day, the Asian Mart. Usually I don't like going into the store because it smells like fish and I hate fish, but I had COVID nose, so it was a great day. I spent that morning making food, taking lots of breaks, but I actually felt like getting up and doing something, and I just considered it my Christmas miracle. And then by 5 o'clock that evening, like a ton of bricks, all the symptoms came flooding back. I had body aches and chills, and then suddenly out of nowhere, I had endless diarrhea. My husband wanted to take our family on a Christmas light tour that night, and I just sat in the front seat thinking, I can't wait to get back to the sofa. I couldn't even enjoy our Christmas lights. So back to the sofa I went. Finally, a week later on New Year's Day, I'd had it with the runs, and I decided that I was going to take the highest volume of Imodium that I could safely take, maybe a little tiny bit more, for the next 2 days. And it finally put an end to the diarrhea. About week 4, I started back to school. And fortunately, most of our classes that first week were just on Zoom, but just getting through those Zoom classes was exhausting. By this time, the aches and the respiratory symptoms had subsided for the most part, but my chest just felt so heavy and ached. My heart felt like it was working overtime, even at rest. And I just couldn't even imagine doing anything more than sitting in front of a computer. And even while I was doing that, all I wanted to do was go back to the sofa. Finally, at about week 5, I was able to taste and smell a tiny bit, but my brain felt like I'd had a stroke. I tried to study for a test like I had been doing for the last 2 years, and I couldn't even retain the information. I remember studying so hard for a test, sitting down to take that test and thinking, I don't even remember that word. I have no idea what that means. I missed assignments, which I never did. I couldn't get organized, and I just felt like life was overwhelming me. I visited my physician a few times over this period. My blood work was normal. My EKG was fine. My physician listened intently. He documented findings. He asked me questions. He encouraged me to share my experience, but he had no solution, no recommendation, and no treatment options. He just kept saying, we just don't know. My husband, who is a research aficionado, shared every article he could find in hopes of finding a solution, but nothing I tried seemed to bring any relief. I finally got back to work after 7 weeks of being out of work. And while I physically was back at work, the level of care needed in the ICU was just beyond my physical and mental stamina. And every shift was just pure torture for the next several weeks. Fortunately, by March, I felt some improvement in my strength and my endurance. My mental clarity was beginning to return. The chest pressure and aching improved. My heart rate remained slightly elevated and the palpitations were a little better. But I still had very little taste and smell. On my best days, my taste buds are sort of one-dimensional, if that's a thing. I can taste maybe one flavor, and it's usually the strongest one, if I'm lucky. And some days I can't even taste that. All my hopes and dreams of being a taste tester are completely shattered. Just a few interesting facts that I've observed over this time. So the first thing that kind of hit me was I was probably the most contagious on those 2 shifts that I worked before I showed symptoms on Friday and Saturday. I worked 2 12-hour shifts in immune compromised patients. I would be in their rooms for 30 minutes, standing over top of the patient and across the bed from a nurse on many occasions, both of those days. And not a single person contracted COVID from that experience. I know there are hotly contested debates over masks and their efficiency and how well they do or don't work. But for me, after that experience, I'm personally convinced that if worn properly, a mask can most certainly reduce the risk of spreading disease to others. And I was so thankful that I did not share COVID with anyone else. Well, fortunately, I was able to tap into short-term disability during my 7 weeks off of work. I only received 60% of the income, which was fine, but I had to use up all my PTO for the remaining 40%, even though I requested that I not be paid during that, that additional 40%. I would have rather just taken the hit on the finances. And it was a pretty big surprise to me. I didn't know that that was going to be the case, because with nursing school and a family, those PTO days are really critical to me. So I was slightly, that was a great disappointment to me, although there's nothing else I could have done. But anyway, so that was another surprise. I lost 10 pounds during this experience, which was great, but I also gained dark circles and bags under my eyes, which I never had before COVID. So Miss Eden, I want to hear your thoughts about that at some point following this panel. Another interesting fact, in the beginning of April, I caught a cold, and it was just a cold. I was tested and it came back negative, and I'm vaccinated. But again, my son brought crud into the family. I caught a cold, and somehow in the middle of all that head and chest congestion, my sense of taste and smell actually was better than it has been since I caught COVID. In my mind, I thought, oh, this is the beginning. I'm gonna get it back. And as soon as the cold went away, so did my taste and smell. So I'm back to about maybe 20% taste and smell on my best days. So everyone's COVID story is different. Unfortunately for me, my family took very good care of me, and they were incredibly supportive on so many levels. I couldn't have gone through this experience without them. My friends and family were empathetic, but as with most people, they had little long COVID awareness or understanding. So it kept the conversation at a minimum, or any support at a minimum, which is fine. I basically limped my way through this spring semester, especially the beginning half, complete with brain fog and physical limitations and all. I assume that if I'd been louder about my situation and sought more help, accommodations could have been considered, but I didn't have any diagnostics to prove long COVID, and I wasn't aware of any school policies in place for those suffering from long COVID, so I wasn't sure how to go about that solution either. And while I made several trips to the doctor through this ordeal, I found an empathetic ear, but no solutions. I'm not a strong self-advocator, so I definitely gave up that fight quickly, but that is something I do not recommend. My experience is different than others, of course, but fortunately within the past few weeks, I've returned to a manageable state and feel about 80% back to normal, other than some lingering cardiac symptoms. And of course, minimal or non-existent taste and smell, depending on the day. My story is just one of multitude, and I can't speak for all the long COVID sufferers, but I do hope that somehow sharing my experience will help in the research and understanding of those who continue to experience this new reality. Like most of us, I'm really anxious to look at COVID in the rearview mirror and make it a very distant memory to tell my grandkids. But I'm so thankful for this opportunity to share my story and participate in this great panel. Thank you very much.
Thank you so much, Jamie. I know you've been through a lot. Every day is a new day at this point, and we're happy to hear that things are starting to get better finally. I also want to thank you for sharing your personal story. I think it takes a lot of courage to talk about these things, especially because there are still a lot of misconceptions and just lack of information. And so you being out here and telling your story and sharing that with others really goes a long way. I know that other people on the call tonight who have experienced long COVID can really empathize with some of those things that you talked about. And hopefully this helps them feel not as alone as maybe they felt previously. I know that, again, Jamie will be at the end for our Q&A as the other panel presenters. And it's actually kind of a nice segue here as Jamie ended talking about some things that helped her kind of manage these long COVID symptoms and get through things. So our last presenter will be Maureen O'Donnell, and she will talk with us, as the screen says here, what are those different mental and emotional effects related to long COVID? And then also some tips on how we can help ourselves and we can help other people. So take it away, Maureen.
Thank you very much. First of all, I want to echo what Sarah just said, and I really want to thank you, Jamie, for telling your story, your very powerful story. Everyone has, their own experience, but it just really was a very powerful and meaningful way for us to hear one person's story. So I'd like to start with telling you that I come and I speak to you with two different levels. The first level is as a practitioner of 36 years. And this is the first time I've experienced something like this, like many of us professionals, but also as a family member of a long COVID sufferer, a brother-in-law who was a high school basketball coach and an avid exerciser who now is being considered for a heart transplant. So it's hit home with many of us, and I can draw from my brother-in-law John's story as well. So I'm going to go forward with this here. The number of long haulers, I think, Sharon said it very well, that we're learning as we're going, and the information about long haulers is still just coming out. And so the number of people with it is significant, but it's also just growing substantially. In Jamie's great story, she had avoided it for 10 months and then caught it in December, the same month that my brother-in-law caught it. And that unpredictability in all of our lives this last year has created tremendous anxiety for everyone. And the unpredictability of long haulers, I think, is even more so, taxing on a person emotionally. But your pain is important. I think that's the first thing that you need to know. And the part that I really like that Sarah said was to have patience, that we all need to have patience with ourselves if we're experiencing long hauler symptoms or with people who are having them. My brother-in-law was told that in the beginning that he had post-COVID pneumonia. And it wasn't until he ended up in the emergency room that he was told he did not have post-COVID pneumonia, but he was going into cardiac failure, that he actually was having cardiac problems. And so, and he was having trouble, as Jamie's husband, having trouble getting himself to help, and feeling like he should ask for it. So I think that your pain is very important. Especially if you're listening to this presentation, don't second guess your pain, don't second guess your symptoms, ask about them. And hopefully, if nothing else has happened, but you've been empowered to ask different people about your symptoms, then that's a great thing that you have gained from this. But your mental health is just as important as your physical health. In fact, I've told people for many years, if you don't prioritize your mental health just as much as your physical health, it will get your attention. It'll take part of your body and it'll make it sick if you are that needy with your mental health and you're not taking care of yourself. But a lot of people experience shame. A lot of people think, what is wrong with me? I have talked to a lot of people who have been experiencing different phases of COVID, and there just comes that, what's wrong with me that I'm suffering more than the next person? I hear that a lot over the years, just with anyone who has any kind of mental health issues, is what's wrong with me. And COVID is something that, Sharon described well. It's affecting all the different parts of your body. It's affecting your brain. It's affecting your neurological system, as she had indicated, and that's setting a person up for mental health issues. And so my invitation is to ask, and to not self-criticize, but to ask, and that will get you the support and the help that you deserve. And to deal with your emotions in the moment. Many of us push past our emotions. Many of us, really literally want to push the emotions away if we can. And they never go away, but we do try to do that. But my invitation is to deal with the emotion in the moment. Let it be there. Jamie had a beautiful story, not of what happened to her, but how she had to work hard to take care of herself. And a good deal of that was emotional, just getting the strength to do what she could, and then just retreating back and taking good care of herself physically and emotionally. But the pain, if you don't deal with the emotions in the moment, that pain will resurface in another form, either through fatigue, either through headaches. I mean, like I said, pain will find a way to get your attention if you deny it. So the invitation, from me, is to not deny it, to ask about it. And it's a good way to attend to it, is to ask someone about it. So the last point here is that it's always easier to stand up to someone else who might be critical to us, but we don't do a very good job with ourselves. We're all very critical, and I think it's on automatic so much. That's why we don't stand up to ourselves. But in this COVID panel and in this COVID invitation that we're all giving you tonight, it's to not talk yourself down and to not criticize yourself, but to give yourself a voice and to talk to people who will listen to your voice. It's critical. So there was an Oxford study done that was released, just last month. And as you can see, tons of people, over 236,000 that they studied in the TriNext network. And the incidence of having a diagnosis with neurological or mental health, baseline to it was 34%. That means a good third of the people, of these 236,000 people, had a diagnosis after having COVID. Now, some of them might have had it beforehand, but it may have been worsened by COVID. But for 13% of them, it didn't exist before COVID. And as I've watched my own brother-in-law struggle, and if anybody has a positive outlook on life, he does. So as I've watched him struggle and heard some of his comments, it's very clear to me that he is suffering from a form of depression. And part of it is because, a big part of it is because this new life is so surreal to him. He said to me at once on the phone, he said, "Maureen, I never thought I would be that person that would be on a heart transplant list. That is not how I've lived my life. Didn't see that coming." So the most common diagnoses after COVID-19 are anxiety. I think that the studies will show us in not too long that the general public, that anxiety was a lot more normal in 2020 than it had been even in years prior. But in people diagnosed with COVID, and especially long haulers, the anxiety is there because it's the unknown and not knowing what all is going to happen. And as I watched my brother-in-law's anxiety shoot up when they first mentioned heart transplant to him, you could see that it's just very real, a very real part of something that everyone was afraid of, everyone had anxiety about, and now I have it, and now it's meaning some very grave things to me in my life. Depression, 14%. Substance misuse. Maybe all of us have heard of one person in our lives, or a friend or a coworker, that talked about ordering a little bit more alcohol or going and picking up a little bit more alcohol to have in their house during COVID. And it's a very real problem that's escalated during COVID for much of the population. But of those who suffered from, COVID-19, it was a way to escape. It was a way to escape, but then it was also coupled with the insomnia and the difficulty sleeping. But you could probably see how that insomnia is probably very connected to the anxiety and depression issues. But the specific symptoms that people are experiencing in the anxiety and PTSD category, what I found as clinician is that if you had anxiety going into 2020, it was worse during 2020. If you had depression heading into 2020, it got worse in 2020. And that's for people that didn't even get the diagnosis of COVID or didn't get the infection. For those who got it, then they got the very thing they were very afraid of. And that sparks anxiety right off the bat. However, which includes fears, restlessness, and irritability. However, if somebody had, this might be a percentage, but a very important percentage, there are a percentage of people that had a trauma background. So they had a PTSD and anxiety diagnosis. And then those people contracted COVID, which worsened and triggered their PTSD. Those people really need to speak out. Everyone does, Jamie's story, what a wonderful opportunity for her to speak out on this panel. But it's good for all of us, everyone who's had that diagnosis, to speak out. The depression will be sadness and hopelessness, definitely increased on the hopelessness. The brain fog that Sharon spoke to, and that Jamie, just kind of personified for us, and her story is a very real, and the difficulty concentrating and the memory problems. And then the sleep disorders are insomnia, but also, remember I mentioned the people with PTSD that were triggered by having the COVID diagnosis. They went into nightmares at that point, and so that's a PTSD particular sleep disorder. So let's see if I can get, there we go. So it's impacted the individual and the whole system. So I was part of the system that was impacted by John's diagnosis and him now. The word that we got just within days is that they're going to defer his heart transplant, put him into cardio treatment because his numbers are looking a little bit better. And we're all just emotionally riding this roller coaster with him, praying our hearts out, just checking in on him, on my sister, and just doing everything we can. So it's the patient, it's the family members. As I talked to John's elderly parents when I was in Tennessee, when I was in Chattanooga visiting with them, it was hard for them to even speak to their feelings, and they were strong people of faith. So that was good. That was what was giving them strength now, but they were just riddled with worry and confusion. Friends, John of course, I told you he was a basketball coach. So teams are trying to cook for him, and my sister, the church is trying to cook. All these people who have known him, he's lived in the same community forever, are all affected. They all have fears and concerns. And then of course his colleagues, Jamie's colleagues, everyone has this important network around them that we're inviting them to access and get sort of support through, but it's impacting that system as well. Okay, there definitely is a need for mental health services. In my 36 years as a counselor, what I have experienced is that it has become more okay, there's been more permission that people feel to access mental health services. But there's still that stigma, there's that shame, there's that what's wrong with me, that people have to get over to ask for help. But it's increasing, it's happening in increasing numbers. And so I put that out to all of you and say, it's more normal now than ever to have anxiety and to ask for help for it. It's more normal than ever to have a mental health issue and to ask for help for it. And there's great services out there. So, the need is there, and we're encouraging it. And your help may have also medication involved with it. It may have lifestyle, exercises, meditation, they prove helpful, as this study has shown on the slide. But I tell people, when you have something like long haulers, that those lifestyle changes of increased exercise that you can do and meditation, or what does give you joy, that you can engage in, it's not a luxury. It's like you're rehabbing your psyche, you're rehabbing your whole system, not just your physical system. There we go. So self-care. You can't take care of yourself if you don't take yourself serious. So what I love about Jamie's story is she took herself serious, and I really liked that comment at the end that if I would have known more, I could have asked for accommodations. That's just because we're all learning as we're going, but that's what we want long haul. What we want you to do if you're experiencing this is to ask for the accommodations you need, whether it's school, whether it's work, whether it's family. Now, whether it's John's whole system helping him out with cleaning and cooking their house. So, but take breaks, pace yourself. You might be forced to take those breaks, as Jamie mentioned, but take breaks and pace yourself. That's going to be critical in your recovery. Don't expect from yourself, and don't criticize yourself if you're not doing what you normally do, because you're in recovery. You're in mental health and physical recovery. So your stress reduction, whether that's right now it's spring in Omaha. So just looking outside at the trees and the colors and the flowers is very, very therapeutic for all of us. And just sitting on the porch and looking at people walking by. Meditation does not have to be serious meditation. It can just be filling your mind with nature, filling your mind with the song, but it is filling your mind with something so you can reduce kind of that, ADHD we all have, it seems. Acupressure might help for you. Just some form of movement. Get up and move if you can, because we hold that stress in our bodies at all times. Yoga is fantastic for that. And I am a proponent, and I engage in yoga, and I can't speak. I think I've always just done beginner's yoga, and I'll always do beginner's yoga, but it does wonderful things for me. And I watched John doing some stretching exercises and how great that was for him. But critical, if you're on this call, if you're in this webinar because you're a part of somebody's system who has long haulers, check in with them a lot and really drive the conversation with, what they need, asking them different things from, how their grocery shopping's being taken care of, their laundry, their kids. There's always a lot of different points in a person's day that you can ask about. But, today we're talking about support for the whole person, and their support groups, and I've listed them here. And I think what I have listed here, as Sharon had indicated, what she had listed is in that resource packet, and this slide is in there as well. And so I really, really encourage you to give yourself permission to see how normal your struggle is and how deserving you are of help. And so I end with a couple of personal stories. Danny said when the fatigue, and Danny's 37, when the fatigue is there, it's hard to focus, it's hard to concentrate, it's even hard just to think. And having a strong social network and a therapist that I like have bolstered her recovery. And then Matt's mother of 5, my family is key. Even just being outside, going for a walk, enjoying very simple things. Maybe we've missed along the way when everything was so hectic. And whether it was somebody infected by COVID or not, but during this COVID time, I've heard lots of people say, I slowed down and that was a good thing, and I'm in that camp. I slowed down and that was a good thing. So slow down and help yourself, like Matson, to experience very simple things. And she says, that's how we lived our lives before COVID, very hectic. We were always on the run. I feel like we do really take the time to appreciate all of the little things that mean so much more. So I thank you. I invite you to speak out. I invite you to bypass, if you're gonna push anything away, push that critical way, not your feelings. And to give me a call if you have any questions, but ask your questions. And thank you very much, Sarah, for this opportunity.
Thank you so much, Maureen. That was wonderful. Just hearing your stories and your brother-in-law John's experience is really powerful. I think it's just a good reminder for all of us. I mean, I think several people on the call already knew this, but for other people that haven't had as many experiences with long COVID or people who are struggling with that, it's a good reminder for all of us to realize that this isn't just a physical experience, that it really extends into all those different realms of our lives and our livelihood. And so it was a just really powerful opportunity for us to hear your perspective as a clinician as well. So thank you for that. At this point, what I would like to do is open it up to some questions and answers. And so I was able to see some different questions that came across through the chat. So I will ask these panelists, if you guys want to go ahead and unmute and share your videos, then whoever it seems like it might be most geared toward is able to respond. I do also just want to make note of the time. We have about 9 minutes, and I wanted to make a quick announcement at the end about some resources, but I want to make sure that we get these questions addressed that our audience members have posed. So the first one is really open to anyone. It says, what do you all suggest that we do as community members to support each other in the current climate of the pandemic?
Maureen, I don't know if you work in the community as a whole, you might have a really good answer for that.
I think that last point, Amy, thank you, Sharon, for asking that last point on that last slide about check-in. I think talk about it. Talk about it and all the effects of it as though it's normal, which will give people who need something permission to talk about it. So talk about it and ask people how they're doing. Slow down your conversations to be very real and very connected.
And perhaps start a support group or something in your area. There's a lot of grassroots efforts that are done by just regular people in the community. So don't be afraid maybe to take that step. However, I do understand if you are suffering from the effects of long COVID, you may not have that energy, but keep looking there. And there might already be a really great group in your area. So keep looking.
Great suggestions. Jamie or Sarah, do you have anything to add?
My only thought is just, if you're not suffering from long COVID, just be open-minded and ask open-ended questions. And if you are suffering from COVID, long COVID, don't stop seeking for help. Advocate for yourself. Find somebody who can be an advocate with you, because you get tired and you just think, oh, it's just me. Maybe there's something wrong with me and nobody really understands. So get somebody, at least one person on your case, who will advocate with you and help you keep going when you feel like giving up.
Very good. That actually connects to another question we had, Jamie. This person asked, how do you deal with COVID shaming when others don't believe how this has affected your life long-term or feel that you're just overreacting? So what would your message be to those who maybe haven't quite realized the significance and the reality of this condition?
So I found in my experience that there are some people who want to know and are willing to listen, even if they start off with a little COVID shaming. And if you just approach it from, and even as a COVID sufferer, an open-minded communication, sometimes you can help enlighten those who don't know. And sometimes it's just not a conversation they're ready to hear, and it'll probably just help you to revisit that at another day or find another support system. I mean, honestly, there are people who are just not willing to listen, and they have their mind made up, and they're, that's okay. I think I couldn't take it personally, and I had to just step back and realize they don't know what they don't know. So I'm going to move on.
Yeah, very true. Very true. And I think I think back a conversation I had with my mom. It's probably been like 15 years ago now, but I told her, I realize I've come to this point in my life where I know I only have so much energy to give. And I know that especially in society, for women in particular right now, we're expected to be the best, at our job and the best wife and the best mom and all these things. And so with something like this, I think sometimes we have to make that choice of, where am I willing to invest that energy? And with long COVID, you don't have much energy to start with, right? And so sometimes it's, deciding when you're willing to engage in those conversations, and when that might have to wait until a different time and place. So I think that's a great point that you raised. Thanks, Jamie. Other question, we'll take one more here. Sharon, this was a question for you. Is long COVID related to chronic fatigue syndrome?
Oh, that's a wonderful question. And for those of you who are unfamiliar with this, we're not calling it so much chronic fatigue syndrome. Usually it's ME/CFS, and that's the ME is myalgic encephalomyelitis, but yes, / chronic fatigue syndrome. The reason I say the chronic fatigue syndrome name is not very accurate. It's a lot more than just having fatigue. And there are a lot of parallels between the ME/CFS and long COVID. For example, severe fatigue, yes, okay, check. But multiple symptoms that can affect multiple places in the body. Yeah, check, check. It's sometimes very hard to diagnose, check. Overexertion can make symptoms worse, check. And oh yes, ME/CFS is usually linked to people who have suffered a viral infection, but they just got over it, but the symptoms just hold on. There's a lot of evidence to say that yes, that's probably what's going on with a lot of the long COVID sufferers. Thank you, Sarah. That's great. Yeah.
Thank you for your answer. I thought that was a good question, and I appreciate the insight that you were able to offer. One last thing that I want to do with just a couple of minutes left here is just kind of share briefly the next steps for our audience members. So we appreciate you all being here and your willingness to listen and to learn and to hopefully be able to better empathize with different people, whether they're the patients you're taking care of, your family members, your neighbors, whoever it might be. The things that we will do, you can expect to hear from us in terms of 2 different emails. The first one will contain an evaluation. We would love to hear your feedback. We are doing a second panel presentation, as it mentions there at the bottom of the slide. And if you have any suggestions for us, things that you would like to see added or modified, we would love to hear that feedback from you, as well as if you found this helpful and if this is something that you can then share with others. The second email you will get has a resource packet, and I'm going to show really quickly if it'll pull up. Oh, I'm not sure because I'm on Kay's screen if it will. Oh, here it comes. Thanks, Kay. Okay, so you're going to get this resource packet, and I know that we're a little bit biased because Sharon and I worked really hard on this, but honest to goodness, everybody on the call, I really think this is one of the most comprehensive long COVID resources in the nation right now. We spent hours, days really, if you added it all up, looking and scrolling through all these different journals and websites and blogs and podcasts to find information that will hopefully help you. And so we really encourage you, as you get this resource packet, to read through it. We have put the kind of more general public user-friendly information at the beginning, so it won't be as overwhelming. As you scroll through the document, you will see more clinical pieces. So those of you that are clinicians or practitioners, you might find interest in those articles. And as you scroll down, you'll see just a wide variety of things that we've tried to make available to you, even by topic. So if you want to learn about brain fog, there's a section on brain fog. If you want to learn more about social, emotional, and spiritual implications, we have a piece for you on that as well. A little bit of something for everyone. And so what our challenge to you is really to use this and to share it. We want everyone who needs this information to get it because it's accurate, it's legitimate information, and there's such a wide variety of supports that we're trying to make available to you. So if you can go back to that last slide again, Kay, I just wanted to touch base on that piece. So that will be coming. We also, like I mentioned earlier, will be posting this on our YouTube channel, as well as a recording of the second one, which will be at kind of a higher level in terms of the clinical exploration of long COVID. So when those recordings are made available, share it, right? We want the message to get out, like we said, to as many people as possible. And then in the middle there, like we said, if you are living with long COVID or someone that you know is, encourage yourself and them to reach out for help. Advocate for yourself and what you need. And then if you are that support person, whether it's family, friend, or provider, make sure that you're doing a really good job listening. You know, how often do we say, how are you? And we keep walking down the hall. Stop to actually listen and take some time. Be there to support these individuals and make referrals as you're able to. And that's where that resource packet, again, will hopefully be useful for all of you. Thank you again, everyone, for your time. It's 7:01 now at this point, so I appreciate you being here with us and being on the call. And if you have any questions, please feel free to reach out. Thank you and have a great night.